If I could bring your attention to the chat box, and there's a link in there to participant guides. And if you open that link, it will have two options. And one is just the PowerPoint, and then the other one is a PowerPoint in notes form, which will allow you to take notes through today's training. And we will repost that a couple of times during the training in case people join us late. And so with that, we will go ahead and get started. So today's training is on MMIS, authorizations and claims for direct nursing services. Today we're providing information to assist with understanding the changes that are occurring as a result of the Compass project. Although you might be surprised to find that there are many things that are staying the same. So before we get started, let's take a look at how we're using technology today. So for today, we're asking that everybody stay on mute through the presentation, and then during the Q&A, the question and answer session at the very end, we'll have people come off mute and ask questions. And then if you could also hold off putting questions in the chat throughout the presentation and hold that until the end, we really want to make sure that we don't miss anybody's questions, and it's hard to track questions coming into the chat throughout the presentation. So there is going to be plenty of time at the end for you to ask questions today. So next, let's talk about participation and getting the most out of our session today. So we're just asking that you listen with an open mind, be present and engaged, including participating. Whoops, it says some folks are still waiting to get into the presentation. Sorry,
I see one person, and that's all I see in the waiting room. And hopefully people are coming in with the correct link.
Okay. The other thing is that if you hear something in the presentation that you have questions for, again, we just have time at the end, some Q&A, actually lots of time for you to ask questions at that point. And then make sure you take care of yourself throughout. We're not going to be doing breaks, but if you need to step away, feel free to do that. One of the other things is that you'll see that we're not on camera today. And so we are just offering that to you as well. If you feel comfortable being on camera and you want to do that, go ahead and do that. Or feel free to just shut your camera off and get comfortable and get ready to participate in today's training. The other thing that we want to bring your attention to is that we oftentimes use examples and names in our trainings. And we just want to reiterate that these are not actual people who receive ODDS services. All right. So then today, again, getting the most out of today's session is attending the entire session, taking notes if that helps you to do that. We have, again, the participant guide that is in the chat. The link is in the chat. And then participating fully in the Q&A at the very end. And then we will also give time before the training is over to complete an evaluation of the training. And that is very helpful for us. So let's review the learning outcomes for today. So we're going to review direct nursing services, define the MMIS and explain its purpose, outline the business process of monthly prior authorization claims, explain the roles of three partners, DNSA, providers, SCs, and ODDS. Identify MMIS record requirements and documentation, and then be familiar with MMIS web portal and be able to enter information. Okay, and these are just how that information is going to be broken up and presented to you today. So there will be 4 units that we'll go through, and then again, we'll have question and answers at the end. And so right now I'm going to hand it over to Ken Ralph, and he is going to provide the rest of the training.
Hi, everyone. Thank you, Teresa. My name is Ken Ralph. I'm the program analyst with the ODDS policy unit, and I work with nursing services. So before we get started, I wanted to just mention that if the information is focusing on MMIS and payments and authorizations. There was a previous training that should be on the Compass website that was taped, a webinar that was taped regarding direct nursing services and unbundling for 24-hour residential providers. So for those of you who are not as familiar or need a little bit more information, you may want to go back to that presentation. Hopefully it would be helpful for you. The other thing I wanted to mention is in this training is, we're gonna hopefully we'll be sharing some information with you, but also hopefully the information is more of a guide for people who end up having to do authorizations and payments. So by that I mean hopefully the participant guide that accompanies this and this presentation will be easy to reference later on to say, here's the processes, here's the things, here's the thing, ways I should look to see about getting into MMIS and stuff. So, so it'll really kind of be focused on that a lot. So before we jump into MMIS, let's review direct nursing services. So we're covering this just to get everyone on the same page by providing a quick review. Shift nursing services. So what are direct nursing services? These are shift type nursing services for adults ages 21 and over who have medically complex needs and are determined by a criteria. They're technology dependent. And then it's a very small number of people that are eligible for these services, less than 1% of people who receive IDD services. We're focusing that on the unbundling part of 24-hour residential nursing, direct nursing services in there. But I think we're going to go ahead and transition into the next slide. So we also want to make sure that we mention that only Medicaid enrolled direct nursing service providers can provide direct nursing services. You have to be enrolled through OHA, and you have to be either certified and endorsed if you want to become a direct nursing service agency, or you may need to be an OHA licensed in-home or home health agency. So how do you become Medicaid enrolled to provide direct nursing services? So what you're going to need to do is to follow the processes that are outlined in the ODDS Provider Enrollment Worker Guide. The worker guide will outline all the different steps depending on what type of Medicaid DNS provider you want to become, but it will explain what forms to fill out, who to send that into, and to make sure that you become enrolled through both any certification and endorsement process if it's for DNSA, but also OHA forms and those things. I want to mention to be aware of the timelines for the July 1st DNS unbundling. So if you guys have not any entities that are thinking of becoming a direct nursing service agency or a direct nursing service provider and want to serve somebody for the July 1st unbundling, we recommend that you get your forms in as quick as possible. So now let's talk about the Medicaid Management Information System, or MMIS. In this section, I'll provide an overview of MMIS and why ODDS uses this system for prior authorizations and payment claims. So what is MMIS? MMIS, it's the federal Medicaid payment portal for authorized providers to submit and receive prior authorization and claims for medical and health-related billings. So there's a few different systems that we use throughout the state, and we often get questions like, why a different system than Express? So let's clarify that now. As part of our Medicaid waiver submission for direct nursing services, ODDS agreed to make claims in MMIS duplicating the process for our private duty nursing services. Private duty nursing are the same kind of nursing services for medically fragile children under the age of 21. So we modeled a lot of what we did for direct nursing services off of that. So also medical payments require a higher level of system security. Therefore, MMIS meets this federal security requirements for prior authorization and billing. So now let's talk about prior authorization and payment claims. The purpose of this section is to provide the information, the processes, the roles, and communication around prior authorization and payment claims. This way, everyone knows who does what, when, and how. So let's start with the requirements around authorizations. ODDS and MMIS need to know the maximum number of projected hours for the upcoming month. So when we talk about DNS being prior authorized, providers have to send us the hours. So for example, a provider needs to tell the CDDP, and I'm going to preface this by saying sometimes I will use the term CDDP and sometimes I will use the word CME, which is a case management entity. They're interchangeable to the extent that most of the conversation we're geared here for is related to 24-hour residential, which would apply to CDDPs and service coordinators. But the payment process for all of direct nursing services is basically the same. So if you're in an in-home situation in direct nursing services, these are going to be the same processes, which is why sometimes I may slip back into CMEs versus CDDPs, but it is intended to be the same. So the provider needs to tell the CDDP how many hours they are projected to work for the next month. After getting approval from the CDDP, the provider then enters that projected number into a prior authorization within MMIS. So knowing this, let's look at how the process works. First of all, completing prior authorizations and payments is a collaborative process between direct nursing service providers, CMEs, and or CDDPs, and the Office of Developmental Disability Services. All the parties have their role in making sure hours are projected for a prior authorization and hours are checked against by the CMEs the total number of monthly hours a person is eligible for. In addition, the providers and CMEs need to make sure hours are correctly totaled on the timesheet so the provider's authorization status can be changed to allow for a provider to submit a claim. So let's break this process down a bit more, talk about these roles and responsibilities for prior authorization, as well as a few key points to consider. In order to meet the requirements of a prior authorization, a DNS provider must at least 5 days before the beginning of the next month or the following month, send to the CME or CDDPs with a secure email and a CC to ODDS, a projection of the number of maximum hours for the month the provider will work with the DNS eligible person. So you need to do that for each DNS eligible person. You can use the odds.rn support email box and include the CME representative. The DNS provider will go into MMIS to create a prior authorization for the projected hours, and they'll receive a PA number in the system. The DNS provider then emails that PA number, including the person's name, prime number, and hours requested, to the case management representative and to ODDS. So let's see what happens once the CDDP receives the email. So as I mentioned, the CDDP is going to review to make sure if a person's authorized for 500 hours that the provider is not requesting for 600 hours, basically. So that's the biggest, they fall within the allotted hours. And you want to make sure that that's on the same email thread so that everybody, there's not constantly changing emails back and forth between ODDS and the provider and the case management or service coordinator entity. If we keep it all on one thread, everything all makes sense and it flows well, and it makes it quicker for authorizations as well as when we get to payment claims. So to help you picture how this works, let's look at the two scenarios. So scenario one is the super duper directing nursing service agency works with one person in the 24-hour home and is the only provider of DNS within the home. The person in the home is eligible for up to 500 hours for the month. At least 5 days before the beginning of the month, super duper agency creates a prior authorization in MMIS, sends by secure email the projected number of maximum hours it will work for the next month, and then also put in the assigned PA number that they've got to the CDDP with the CC to ODDS. The agency sends the projected hours for 450 hours. Then that means the agency nurses may work from 0 to 450 hours in that month. Now what happens, let's see what happens if there are two agencies in one home. So now you've got, let's say, Acme DNS agency and super duper DNS agency deliver direct nursing services to the same person in the home who's eligible for 500 monthly hours. Acme and super duper both send in prior authorization notification for 250 hours each. Most months they work up to the 250 hours per month, keeping the actual total actual hours billed for at the person's eligible 500 hours. Sometimes the agencies may have trouble filling all of their nursing shifts. So if during the month of work, hours need to be adjusted. So let's say one agency says, oh, we lost our nurse, and so we're only going to be able to do 100 hours. Then the other agency, if that agency submits the request to the case management entity or the CDDP and says, we can bump up our 250 to 350 hours, that ODDS can authorize the change in PAs. So they already had a PA that said 250 hours. If it occurs in the same month of service, it was prior authorized and approved by the CDDP, and the total hours do not exceed the authorized monthly amount. So there is some leeway to do that, but providers have to immediately notify the CDDP if there's going to be a change. Note that the number of hours a provider can work are determined by the provider. So providers are independent providers, and they make the decision how many hours they're eligible for, or excuse me, how much they're willing to work. So they drive that bus in terms of how many hours they can do. So it requires good communication. As I mentioned, we're talking about if there needs to be any changes, because we want to make sure that none of the providers goes over the total prior authorized hours. And particularly, they can't go over the prior authorized hours and the hours that are allotted for that individual person. So you want to make sure that everybody's staying within those hours, both agencies in that regard. That way, nobody has any problems with payment, and we don't have any conflicts that way. So, and I don't think, and talking with Chris Munn, who has worked with this process for a while, I don't think we have too many situations like that where we've run into a problem regarding somebody saying they should have worked more hours or they worked more hours. So, but let's talk about some other considerations. Let's talk about the payment claims process. So claims are usually submitted at the end of a month. The DNS providers send the timesheets and invoices to the CDDP with the PA number. With the PA number, so they can look that up. The CDDP will verify accuracy of the invoice and timesheets and ensure that the approved hours did not go above the allotted amount to that individual based on the criteria memo and the ISP hours. Once reviewed, the CDDP will send approval to ODDS, and then they'll also attach the timesheet. Invoice needs to be attached or scanned, and email should be on the original email string. So now let's see what happens when ODDS receives the approval from the CDDP. So ODDS will review the timesheets and invoices. Once all the reviews and approvals are complete, ODDS will change the DNS provider authorization status. By knowing that number, they can go in and change it from evaluation to approved. And then ODDS will send the DNS provider an email notification that it can submit the claim based on the PA number with the approved number of hours. So that's when the folks at the provider office can put in for the dollars and get paid. If you don't, if the provider, you do not hear, you submitted stuff to the CDDP, and after, say 72 hours or 3 or 4, maybe 5 days, if you haven't heard anything from our office saying, here's your, you're now authorized to submit your claims. If you haven't heard anything from our office, then we ask you to check with the CDDP service coordinator to see if there was some kind of problem. If either the email didn't go through, or the service coordinator or the administrative staff are still, maybe they're on vacation or somewhere and they didn't get the message. So that means we didn't get the message, or they didn't send in their approval. So expect a little bit of a time for a processing time, but if it's too much, go ahead and check in with the local office. So. Now let's talk about some other considerations. So, things to consider for prior authorization and payment claims. Projected hours must be sent in and authorized before the provider starts any work. A provider will not be paid for DNS hours it may have exceeded above the authorized hours. The authorized hours equals the DNS eligible hours as determined by the DNS authorization memo and documented in the person's ISP. In order to prevent delays in payment processing, invoices should be clear, concise, accurate, typed, and sent in a timely manner. And we talk about no later than 12 months. There's a systems requirement under MMIS that we don't have to pay after 12 months if you haven't submitted after before 12 months, excuse me. So please get your timesheets and invoices and prior authorizations and claims in within 12 months. Let's see, here's some more considerations. So you want to make sure you send up your time. You can set up your timesheets how you want, but they need to have essential information. They need to have prior authorizations of projected hours, and claims for hours must be sent in for each eligible person you intend to serve. And at the very least, timesheets or invoice must include, so they have to have the name of the person, the date, and all those month, date, and year of service, the daily start and end entries, end time, the provider agency, and then a provider signature line. When there are multiple DNS providers in residential settings, CDDPs do not have to wait for all timesheets by all providers to come in before processing the review and approving and sending confirmation. So if Acme completed their timesheets and submitted their stuff before Super Duper, the CDDP can process and send the Acme stuff in first, if it's first and right away, so that they can get paid. And then Super Duper would be second in line, but that doesn't matter as long as the combination of those two providers do not go over the allotted hours. So that's quite a bit to cover. So know that you're not alone and we have resources to support you. So let's talk about a little bit about setting up in, or excuse me, yeah, an MMIS portal and access resources. We're not going to go through a full MMIS training. This section will help you get familiar with the portal and point you to resources. But let's see how you can get set up on the in MMIS. So when you become, after you've been notified that you have become a qualified enrolled OHA provider, you'll be sent an email with a 6 or a 9-digit Medicaid number. The 9-digit Medicaid number is sometimes referred to as your NPI number. The 6 is the Medicaid number. I think you're going to end up using the NPI number more. You'll also be sent by email a PIN number issued by OHP, and that PIN number is case sensitive and allows access for your provider to be able to enter into MMIS. I believe you might have to, providers will have to go in and then they put in a password. After they log in and using the PIN number, they'll have to put in a password. You'll still want to make sure you keep your PIN number information. So that's a way how you start to get yourself into MMIS. There's some handouts and more information on the participant guide that will help you, as well as a list of training resources. So let's go to the next one. There's a few things in the next couple of slides that I just want to touch on that are going to be helpful for you when you're, as a provider, going to be billing and making claims. You want to make sure that you are submitting, having an understanding as part of the MMIS claims that direct nursing services have different types of procedure codes and modifiers to use. So if you're an agency and you use RNs and LPNs, you're going to be billing separately for, I mean, not each, but you're going to be separately for the total of agency RNs under one procedure code and agency LPNs under a different procedure code. And you could see that the modifier codes are different there. We also list for informational purposes, the self-employed RNs and self-employed LPNs, procedure codes and modifiers. For you, if there's any agencies here that are going to be working with the 24-hour residential homes as new direct nursing service agencies, that means you became certified and endorsed, and then you went through OHA, and now you're going to be submitting your claims as you're going to start as of July 1st. You will be using the agency RN and LPN procedure codes and modifiers listed here. So a little more information around prior authorization claims. PAs and claims are calculated in 15-minute quarterly units. To make claims, the diagnostic code, J9620, must be filled out. Under the division code, you want to make sure it reads SPD-CIS 9716733,000. And you want to make sure you have individual prime numbers in front of you so that when you're submitting individual claims and billings, you're going to always need to put in prime numbers. To let you know, the hourly rates are available in the expenditure guidelines. But one of the things that will happen is when you put something in for under agency RN, there's a certain procedure and specialty codes that will use the they'll use the that will put in the hourly amounts automatically. So I believe so. But if you need to know what the hourly amounts are, and also remembering because these are quarterly units that you're going to be entering, you can find those in the expenditure guidelines. So the next bunch of pages I want to tell you are, this is a cheat sheet. There's two cheat sheets. One is how to enter a prior authorization and how to enter a claim. We're not going to go through all of this. I mean, we'll just go through one page at a time, but the in your participant guide will actually have the steps on there. So they'll reference for the arrows, and it'll tell you how to enter the prior authorizations and what things to put in and how all those things are put in. So let's go ahead and hit the next page. So once again, it'll be a step-by-step and the next page. And it's because it doesn't list, I mean, it has the arrows and things. This is a visual cue for you, but there are the instructions that accompany this on the participant guide. So if you want to go to the next, yeah. So if you can keep going, there's the different procedure codes and different rates, and right. There you go. And then here you'll see, once you get everything in, it'll say it was successful, and it will give you your prior authorization number. You're going to make sure you write that down or have that down so that you can go back and reference your PA number. And also you're going to be passing that on to the CDDP and let them know this is my PA number with however many hours I entered. So let's go real quick through the next set here. So these are how to submit claims. And there you go. So once again, I didn't think this was appropriate to be going through each one of these, but I'm hoping that you'll be able to take the participant guide and use that information when you go to use those, when you go to start entering into MMIS after you've become a enrolled provider. So in the participant guide, I think we have these instructions. There's the MMIS authorization and payment worker guide that I talked about, or I have mentioned before in previous. There's trainings. There's a prior authorizations flow charts, how to submit a claim, and I believe that is it. So what's the next slide? There you go. Here's some more resources. My apologies. Some more resources. And then myself and Rachel Olson's contact information is here. And then we are open for questions. So I really appreciate everybody's patience going through this, and hopefully both with the visual things that you see and a little bit of what we talked about, it helped a little bit. So, so I think Teresa's gonna monitor to see if there's any written something on the chat. But if you have some, if there's something in the chat you want to, we can start with that. And if anybody wants to raise their hand and ask a question, we'll go for it.
It looks like we have a question from Gloria. She asks, for innovation, would ODDS be okay if we have the provider fill out a Google form, which generates an email that gets forwarded to ODDS instead? It would have all the same information for the prior auth and final.
I would think that would be okay, as long as it has all of the information that needs to be on there. And as long as both the CDDP, the provider to the CDDP and to ODDS RN emails are on there, so that everybody is seeing the same information.
All right. She says, thanks. We may not do that. Just thinking out loud about innovation. It is a good idea. I don't see anything coming through the chat. I'm checking to see if anybody has their hand raised. All right. Okay. So one more question. Are there any CMEs that enter the PAs in MMIS on behalf of the RNs and agencies?
Oh, I don't think so. I don't think they, CDDPs actually put the PAs in for people. That's the provider's responsible for that. I don't even know if the CDDPs could do that. Well, if you think of any other, if you think of questions later and you want to send them on to myself or to the ODDS RN box, I'd be glad to try to help answer questions and give you more information.
All right, thanks, Ken. Just so that you guys know, we have a Survey Monkey link in the chat, and that is a survey and evaluation of the overall training, and it's really helpful to get that feedback. We use it to make adjustments and improve our training for you guys. So we read all of the comments and read all of the evaluations, and it really does help us in creating future training. So we will go ahead and we're going to go on mute for about 3 minutes and give you guys some time to complete the Survey Monkey. And if you have any questions, we'll be monitoring the chat as well.